Hello, my name is Ilaria Geddes. I am a research fellow at the University of Cyprus, and today I am presenting the EDULEARN project. EDULEARN stands for Urban Care to battle climate change impacts on urban ecosystems and health across different European climate zones. It is an Erasmus Plus project. And presenting the educational component of the project, which is all about teaching urban health, research-based learning for sustainable urban planning, design, and governance. The project itself has three specific objectives. One is the knowledge transfer of a pre-existing methodology, the urban care methodology, by applying it in 4 case studies in the participating cities where the universities are located: Gothenburg, Berlin, Florence, and Nicosia. The second objective is to develop a platform, a digital platform, which is an urban health spatial planning tool, but can also be used by the students to develop their understanding of the built environment and their project. And finally, the capacity building objective, which is the educational objective of the project, to develop transferable learning modules about urban health, which equip future professionals with the competencies needed to plan, design, and manage healthier and more climate resilient cities. The urban care framework itself is a pre-existing spatial methodology with 3 steps. So it connects environmental and health research with stakeholder engagement and problem solving, as well as spatial design through participation and digital innovation. This translates into an educational approach by applying, implementing research-based learning, by including fieldwork and data collection activities for the students to carry out the place-based local research component of the methodology, and also including the practice of participatory skills, as well as exposing the students to real-world constraints of decision making, such as financial constraints or differing stakeholder opinions. Just to show you the timeline of the project, in 2024, we focused on the research component, where we collected the data about the case study, which was used to develop the digital platform. The case studies were also the same case studies that the students used in their coursework. And in 2025, we implemented the decision-making workshops, which were integrated with implementation of the pilot courses themselves, first at the University of Florence, then at the University of Cyprus, and then at Chalmers University of Technology. The reason why we proposed this project originally is because climate change is really reshaping European cities through rising temperatures, storm events, loss of biodiversity, as well as widening environmental inequalities. And these are dynamics which have direct and indirect public health impacts, including heat stress, reduced walkability, mental health pressures, and more generally, exposure to degraded urban environments. Now, architectural education and planning education institutions are not required to include health in their scope. And also the few universities that offer training programs that's about urban health. There are very few programs that actually equip students with the interdisciplinary skills needed to understand and improve urban health. So previous research has highlighted that these few available urban health programs only focus on a narrow range of methodologies. They lack training in mixed methods and participatory action research, and also they do not expose students to governance issues or field-based learning opportunities. So EDULEARN was really established to address these gaps. Each institution that is participating in the project face different curricular constraints, but also opportunities. So the courses were designed as flexible modules with shared learning outcomes and themes, but the delivery format, credit structures, case studies, and disciplinary emphasis were adapted locally. So this is an overview of the literature around education of urban health, of the field itself, but also the specific components of our approach, the research-based learning and the integration of participatory and digital skills. I'm not going to go into this in detail. I will say that urban health is a very interdisciplinary field, which links public health and epidemiology with planning, urban design, geography, sociology, public management, and other related disciplines. So architecture and planning programs, traditionally, they may cover things like sustainability or ecology or environmental design, while public health, on the other hand, will focus on population health outcomes, but without much engagement with urban planning and design processes. So the two are not very well integrated. With regards to research-based learning, the links between research and teaching are really especially valuable when students actively participate in inquiry processes, in knowledge production, rather than simply, say, consuming the research outputs that are presented to them. And with regards to participatory and digital skills, so digital competences are not limited anymore to software operation, but also to the capacity to locate, interpret, create, and communicate information through digital tools, as well as the critical evaluation of digital resources. So this is why we developed the specific platform. Co-creation and stakeholder engagement are really necessary conditions for sustainable urban transitions. So now future professionals do not only require technical skills anymore, but also the ability to communicate evidence, facilitate dialogue, and understand institutional and political settings in which decisions are made. The implementation of the pilot courses translated the urban care methodology into a higher education context, mostly through thematic adaptation and pedagogical adaptation. So the urban care approach has 4 themes: walkability, urban health, stormwater runoff, and biotope loss. And these were essentially operationalized as teaching themes to guide the course content, the fieldwork, and the design tasks. So while the urban care methodology remained constant, public health research, fieldwork, neighborhood diagnostics, stakeholder engagement, the disciplinary focus, the institutional setting, and the pedagogical format was adapted to each participating university. The syllabi were developed collaboratively by the consortium. They combined a variety of materials and format, and they made use of digital resources, including the data viewer and the platform, of which you have an example here for the students to follow the syllabus and also have access to the course materials, summaries, video lectures, links to reading materials, quizzes, and so on. So we had 58 students participating across the 3 institutions, and then the courses were evaluated using a mixed methods approach. So the results are that overall the courses were evaluated very positively by the students. We actually had them self-evaluate every competency that they were supposed to achieve. So every learning outcome that the course was targeting. The most positively rated competencies included understanding the links between urban form and health, interpreting environmental data, teamwork and collaborative problem solving, presenting evidence-based proposals, and also awareness of the labor market relevance of sustainability skills. So here on the right, you have just an example from one course of how the students self-rated their understanding of urban health prior to the beginning of the course and after completion of the course. With regards to the digital skills, but also some limitations of the project, delivery constraints. The UCare platform, the data viewers, you can see screenshots here on the right, supported asynchronous learning, access to case study resources, and data visualization. The platform itself allowed users to move from neighborhood scale conditions here to street level conditions, providing the students with evidence about certain climate mitigation targets, such as urban heat, stormwater runoff, and biotope loss. Regarding walkability, the viewer offered surveys enabling the users and therefore the students to score the quality of specific urban locations and so reflect on their own experience of place. So the viewer, we think the viewer supported three important learning outcomes. First of all, it strengthened spatial literacy because it enabled the students to relate environmental indicators to specific urban locations. It also improved evidence-based reasoning. So design proposals were justified through observed phenomena. And it supported participatory learning because they shared visual evidence base, facilitated discussion during the workshops, role-play exercises, as well as group design reviews. Now, two key limitations were the fact that full cross-enrollment between universities, which we had initially planned, proved impossible. This was due to incompatible academic calendars, differing credit systems, institutional regulations, governing access for external students. And while the online components did widen access to international lectures and collaborations, the students overall found it easier to follow and to participate when activities were fully in person. So to conclude, urban health, I think, proved to be a very effective integrative theme because it really connects climate adaptation with environmental and spatial justice, health, and well-being. Engaging with real case studies and real stakeholders really improved motivation for the students and exposed them to the complexity of real decision-making contexts. But institutional innovation is really as necessary as pedagogical innovation. So even when the teaching modules themselves are successful, scaling joint learning activities really requires greater interoperability among universities in calendars, in credit recognition, and in participation rules as well. That is all. Thank you very much. Please do get in touch if you have any comments or questions.